Hi, my name is Amy Mihaly, and I am presenting as an FNP student in my final semester, a case study for my sports medicine rotation at Associates in Family Medicine in Fort Collins. My case is on back pain. I had a 15-year-old patient come into my clinic complaining of low back pain. She was young, athletic, Caucasian, in good shape. Her chief complaint is the sports medicine consult for low back pain, followed from urgent care visit. Her HPI, she has been having off and on back pain since 8th grade, but it worsened significantly this spring when she both threw in track and played club volleyball at the same time. She does not usually take ibuprofen for this, but it is starting to affect her play. She states that her pain is bilaterally on both sides of her midline, about 5 to 7 centimeters from midline. It radiates down to her glutes, but not below her knees, and up a little bit on her back. It's a sharp pain right in the center of her back, about L4, L5, and then some burning, aching around that area. She has no medications that she takes regularly. Her only allergy is to sulfa drugs. She has past medical history only of this back pain since 8th grade, and she has non-contributory family history, no surgical history, and social history, never smoker, attends high school. On physical exam, she was in general good health, no apparent distress, well-appearing young woman. Her cardiac, pulmonary, and psych eval were all completely normal. On her musculoskeletal and neuro exam of her lumbar spine, we did notice some abnormalities. She did have normal lordosis of her spine, no scoliosis noted, no masses. She was tendered to palpation about the level of L4, L5, and that when we palpated, the pain radiated down to her glutes mostly. However, again, not below her knees. She had full sensation of S1 and L5, which we tested bilaterally on her legs, and her DTRs for her lower extremities were intact and normal and equal. Her motor on her right, she had full strength of her hip flexor, knee extensor, ankle dorsiflexion, great toe extensor, and ankle plantar flexion. On her left side, she had normal strength, 5 out of 5. On her ankle dorsiflexion, great toe extension, ankle plantar flexion, but she only had a 3 out of 5 for strength of her hip flexor and knee extensor. We also obtained a x-ray from urgent care which showed a normal spine. Her differential diagnosis at this point were muscle strain, spasm, or sprain. Also pyelonephritis, stress fracture, herniated disc, or vertebral subluxation. I've since learned that a muscle sprain only occurs on tendons, so it cannot possibly be that. However, a muscle sprain or strain is possible, but based on her symptoms and the length of her symptoms, that did not seem to be as likely of a candidate. Pyelonephritis was ruled out because she has had no fever, including today, and no other symptoms of a UTI. No stress fracture or vertebral subluxation, which we know because of the normal vertebral x-ray. That leaves us with herniated disc, which was our high suspicion anyway. And my preceptor decided herniated disc of L4, L5, centrally located, was the most likely. Centrally located because she did not have radiating pain down below her knees on either side of her legs. The plan that we gave her was to continue practicing games as tolerated based on her pain, that she may take ibuprofen before and or after the games to help with that pain level, to start physical therapy, which we gave her prescription for, and the physical therapy was to strengthen her core as well as correct that balance between her two lower extremities. There possibly are muscles that are not firing that need to be reactivated. We also scheduled her an MRI on Friday, and she was to return to the office on Monday for a follow-up visit. My preceptor reviews the MRIs with the patients in the room and comes up with a further plan if any treatment plan is needed to be changed. And then follow up this weekend as she needed. This was last Friday, so I did see her this past Monday, and we reviewed her MRI results. She did have a centrally bulging disc. It was actually at L5S1, but correct on all other accounts. The disc was the reason why it was a centrally disc. There's no nerve impingement because the disc was not bulging into any of the nerve passage spaces, the foramens, only in the posterior space. So no nerve involvement, and there's no problem with that. Really important that she just needs to get a strong core so that she does not further injure herself, as well as fix that motor of her legs that's unequal. The evidence-based practice article I chose was from the Journal of Manipulative and Physiological Therapeutics. The title was Lumbar Disc Protrusion Rates of Symptomatic Patients Using MRI. What this study was a retrospective planned study of almost 2,000 MRIs read by the same radiologist. Approximately half of them were done in the seated position and the other half done in the lying position. They found a 73% rate of discovery of a disc problem in the seated and a 50% rate in the lying position. This was higher than the national average, which was great. And the conclusion of the authors was that it is still reasonable and important to use MRIs when the first line treatments and thoughts about lower back pain do not work. This would be a reasonable test to find a disc problem if that is what is suspected to prove. The theorist I chose was Orum's self-care deficit theory. This states the idea that at times a patient needs a nurse to partially or fully assume their care at a certain level so that a certain level of care can be maintained during a period of healing. In the place of a patient, if the patient is a child, you can insert caregiver. I felt like because my patient was a teenager, both the caregiver and the mother were important, who were both present. They did need some help finding out what they needed to do further to correct her back pain because they could not figure out any further on their own and it was beginning to worsen. Hopefully with physical therapy that will be fixed and they will not need to have a nurse or other provider caring for them through that. They should be able to maintain a self-care after this. Thank you.